This weekend marks 5 years, hard to believe, since former San Francisco Mayor London Breed issued the order to shelter in place during the pandemic.
Yeah, that decision sparked a lot of controversy, and the city is still feeling the effects. I got a chance to sit down with the former mayor to talk about her decision and whether or not she would have done anything different. At the time, if I can take us back, people were absolutely terrified.
Yes.
They were seeing the death rates in places and the body bags,
Yes.
and you had to make a snap decision.
Yes.
Did you have any doubts?
I didn't, because what I was mostly thinking about from day one is how do I prevent that from happening in San Francisco? How do I stop something from happening? What can we do to make sure that the people of the city never feel that way? I definitely was always at the top of the mind. If someone showed up to a hospital with their grandmother, I was raised by my grandmother, if I were turned away from the hospital, I can only imagine what I would have done. So I knew that that's how people were feeling about their relatives. And so it was very important to make some hard decisions. It wasn't even a question for me to do it. I wanted to potentially do it sooner, but there's always a lot of politics. There's always a lot of, uncertainty and confusion, and there was a lot of misinformation out there, but it was necessary, and I'm really glad that looking back on where San Francisco was, being one of the safest cities during the pandemic, that we made the right decision.
The shutdown was supposed to be, what, 3 weeks? And it really got extended. And living under those conditions, it was really restrictive.
Yeah.
In hindsight, I mean, people blame you now for waiting too long to reopen.
Yeah, and of course there's going to be, you didn't open fast enough or you opened too fast, but ultimately the data speaks for itself. I think that what I had did as a leader is, the last thing I wanted to do was keep the city shut down. And because it impacted us in many other ways. But at the end of the day, I used science, I used the data we had and the understanding of what was going on. And also, I weighed that with what we had in terms of our capacity to handle a significant outbreak. So I had to think about all of those different dynamics. And it's easy to be on the outside and, of course, criticize, but I had a decision to make, and every decision I make was about protecting and saving lives and doing what was in the best interest of the people of San Francisco, which sometimes is not always popular.
Kids were not going to school. Mm-hmm. They were teenagers, mm-hmm. weren't able to interact with one another. How are you assessing the damage that was done to them socializing and becoming and being educated?
I do think that it had an impact on socializing. It had an impact on mental health for sure. And the challenges are still with us today, which is why many of the investments I made outside the scope of the required investments in the school district centered around mental health.
Did you ever ask yourself, here I am, I'm running my city, things seem to be going fairly well. Why me? Why do I have to face, a once in 100-year pandemic?
Of course. I mean, I wanted to have a good time. Of course, it's a hard job. I was looking forward to doing a number of sister city trips. I was looking forward to doing the work that I did around mental health and some of the work we've done around substance use disorder, like all of that, I felt got a tad bit delayed. We were doing it still, but at the same time, the pandemic sucked up all the oxygen in the room.